Welcome to the Wellness Health Services Health Talk. My name is Dr. Derito. I am a family physician. Today we are going to be talking about suicide. Remember that this is not for medical purposes, it's for general information. So for your medical treatment, seek your medical advice from your regular health provider. So we get into the topic of the day, which is suicide. Suicide is a situation where one attempts to take his own life. There are various definitions of suicide. We have suicide attempt. We have whereby someone attempts to end his own life, and there is persistence of suicidal ideation. There is suicidal ideation whereby someone is preoccupied with thoughts of taking one's life. We find that globally, suicide affects over 700,000, causing over 700,000 deaths, and usually it affects persons between the ages of 15 and 34. 77% of the global suicide occur in low and middle income countries. So we can see that suicide is a major public health problem in low and middle income country, where Kenya is part of that constitution. So the purpose of this talk is to realize that suicide is preventable with very timely evidence-based and low-cost interventions. So it is something that can be prevented if these individuals are identified on time. Mostly it happens impulsively, and this is associated with mental disorders, alcohol use, and the previous suicide attempts. Persons who have attempted suicide before are likely to attempt suicide multiple times, and it is associated with moments of crisis, inability to deal with life stresses such as financial problems, relationship breakups, chronic pains and illness. It is also associated in individuals who have been involved in disaster, conflict, violence, or abuse by others. The individuals have a sense of isolation, and it is also high among people who have in crisis situations like migrants, refugees, gay persons, bisexual and transgender individuals, and persons of intersex. So the commonest methods of suicide include pesticide, self-poisoning. These are either insecticide used for animals or in agricultural practices. We have hanging and the use of firearms. So how can we prevent suicide? Among the major ways that we can prevent is limit the access to means of suicide like pesticides, firearm, and also certain medications that are used for treatment of individuals. Interact with the media to have responsible reporting of suicide issues. Psychosocial emotional support for persons with suicide ideations, identification in the healthcare system, and also management and follow-up of persons affected by suicidal behavior. So some of the challenges that are faced because of suicide, we have a stigma whereby talking about suicide is considered as a social misnomer, and you are seen as a social misfit. But the truth is, this is an illness where there is care. In Kenya, we have emergency crisis number which you can call to get assistance if you have problems with persistence of suicidal ideations, and you can call immediately, anytime, day or night, and you are likely to get help. And also, as a country, we need to improve on our data quality so that we establish the extent and the various methods that are used for suicide, and so that we can come with the relevant mitigation methods. So in summary, suicide is a situation whereby you have individuals attempting to take their own lives for various reasons. It is common in persons with crisis situations, and usually affects persons between the age of 19 and 34 years, but it cuts across all the age groups. There are easy methods to be able to prevent suicide, which include limiting access to means of suicidal, proper reporting of suicidal information, and the identification and treatment of patients with suicidal ideations, and also access to the emergency helplines if you have persistence of these suicidal ideations for medical help. Thank you for listening to me.